for more years than some of you have lived. Dr. Collier and I, when we were babies, worked at UTMB, and not together, but very closely together. His talk today is the transsexual phenomenon, advances and challenges at present. He is a semi-retired clinical psychologist and sexologist who is a full clinical professor in UTMB's Department of Psychiatry and Behavioral Sciences. He helped establish Galveston's Rosenberg Clinic, where he had a private practice for over 35 years. He's published numerous professional articles on human sexuality and transsexual medicine, and often lectures on these topics at professional meetings. I'm very grateful that he's come down from across the great water to speak to us, and look forward to hearing what you have to say.
Thank you, Margaret. And Mary Case, and thank you all for allowing me to be here today and enjoying this service with you. I'm socially distanced. Okay. It's my pleasure to talk a little bit about the history of transgender, transsexual treatment here in Galveston. Before I start, though, let me do a little caveat, and that is terminology has changed a lot over the years. When I first got into this business back in the 70s, mid 70s, well, actually early 70s, mid 70s, I don't know, last century. I worked at the UTMB. I was doing my residency in psychology at the time, and Margaret and I met each other at a place called Community and Social Psychiatry. It was a little two-story house at the corner of 11th and Mechanic, if any of you remember back in those days. It has long since gone, but that's where the gender clinic began. Back in the day in this country, it was 1952. It is a date that really stands in the mind of many of my patients. That's when an ex-GI by the name of George Jorgensen went to Denmark to begin the transition process to become female. He came back to the United States, hit the press, and so many people came out of the closet, because I still have patients today who remember that date vividly, because at that point they realized they weren't the only one with those feelings in the world, because nobody knew much about this. Nobody had ever explored this or studied this. And so he became quite the sensation. She became quite the sensation. And what happened at the time is gender clinics began to develop around the world, because people were coming in asking for help. One of the first in this country was at Johns Hopkins in Baltimore. There was also the University of Minnesota in Minneapolis, Stanford in California. And there actually was a little island off the coast of Texas called Galveston Island, where this also had been studied. In fact, the first sex reassignment surgery, as it was called at the time, we have had terms like such as sex change, sex reassignment, now it's gender affirming surgery or gender affirming healthcare, was conducted at UTMB, John Seeley Hospital, back in the late 60s. I think Eugene Schrang at the time was the chief plastic surgery resident and did some of the first surgeries. He then moved on to Wisconsin, had a full career doing this type of work. And one of his students at UTMB, Ted Wong, picked up the challenge and went forward. And he was the one pretty much during my career with UTMB was doing those sorts of surgeries. Also, Charlie Powell in OB-GYN was doing surgeries on our men, on females to male. At the time, there was a nationally recognized sexual dysfunction treatment program at UTMB. Pat Blakeney, Dan Creason, Charlie Powell, and others were in that program. And that's where couples with sexual difficulties, sexual concerns would come. We set up like a weekend workshop. We used the Galvez, we used the flagship, and couples would come together and go through exercises and meetings and the like. Don't worry, there were no cameras. It was all very private. That is against ethics. You don't watch people having sex. But they went back to the privacy of their room and conducted exercises, and then came back in large group meeting. And this went on for several days. And the success rate for those couples initiating the process of change was quite good. Well, at the time, there was a desire, gee, in terms of the DSM, which is a Diagnostic and Statistical Manual of the APA, American Psychiatric Association, there are three major types of sexual disorders. One are the psychosexual dysfunctions, and that's what this program addressed. One was the paraphilias, which are the sexual deviancies, sexual affinity behavior. And the other was the gender identity issues, the transgender community. So a call was put out. Dr. Bob White in psychiatry at the time went to some lectures around the country and heard a speaker at Hopkins by the name of Paul Walker. And Paul was a clinical psychologist, had done his training there. And he was recruited on the faculty at UTMB back in '75. One of his colleagues at Hopkins at the time, Walter Meyer, a pediatric endocrinologist and psychiatrist, was also recruited. And when they came to Galveston, they established the gender clinic. And so we now had all the bases covered to address sexual concerns and problems. I was again doing my studies at the time and found this very intriguing and interesting, and started joining in, attending some of these sessions with Paul and others, began to learn about the phenomenon myself. So that's kind of where things began. And today, many of us are semi-retired. Dr. Meyer is still working. There are other colleagues in family medicine. One of our proteges, I guess, who got his PhD in psychology at U of H, came down and went to medical school. His name is Colt. And Colt is now doing his residency in family medicine at the Mayo Clinic. I'm sure he'll be back here when he finishes that, because he's born and bred Texan. And so he'll probably pick up the torch from then and continue on with our gender clinic. One of the things that began back in the '70s, there were no guidelines. How do you work with people like this? Well, you went to one clinic and they say, well, you need to start dressing as female or dressing as male, and we'll provide hormones and we'll watch you for a while. And other clinics, you came in and provided your paperwork and they said, okay, we'll schedule for surgery next week. It was very haphazard. And so what happened was, back in 1979, a professional organization was established called the Harry Benjamin International Gender Dysphoria Association. Harry Benjamin was one of the first American physicians back in the '40s to write on this subject. He wrote a classic book in the '60s called The Transsexual Phenomenon, still available. And so he became the guru, and he was made honorary director of this association. And one of the first challenges the association was to address was to develop what are known as the standards of care, the SOC. They were first out in 1979. We're currently in the 7th edition, with the 8th about to be published soon. What are these standards of care? Well, let me quote from the overall goal of the standards of care is to provide clinical guidance for health professionals to assist transsexual, transgender, and gender nonconforming people with safe and effective pathways to excuse me, to achieving lasting personal comfort with their gendered selves in order to maximize their overall health, psychological well-being, and self-fulfillment. So that's the goal of the standards of care, is to set out regulations for physicians, for doctors, for psychologists, professional surgeons to follow. It gives guidance to people who are wanting treatment for this type of situation. And it also establishes information for the public. These standards of care are recognized today by the American Medical Association, American Psychiatric Association. Most of your professional medical groups recognize these standards of care and subscribe to them. So that's kind of where the standards of care originated from. Here. At the time, I completed my training and I joined the full-time faculty in the Department of Psychiatry. And after a year or two, I got smart. I said, well, let me move out into the private sector and get a private practice going. But I was able to keep my clinical appointment, teaching and so forth at UTMB. And my associate at the time was Dr. Lee Evangeline Emery. She bought the Rosenberg Clinic at the corner of 25th and K, nice, lovely 2-story house. And in 1983, we established the Rosenberg Clinic. And it was there till about 2015, I think, when it finally closed. So for 30 plus years, we treated all sorts of individuals, including gender folks. And we were well known. Dr. Meyer continued as full-time faculty at UTMB. We were also involved. So we all had patients coming to Galveston. And we had them from all over the world, literally. Most came from Texas, Louisiana, but we had patients that came from East Coast, West Coast. We didn't advertise. I mean, we did studies, and we published those studies in professional journals, so people knew about us. But we didn't go out and advertise, come here. That was the problem that San Antonio got into back in the time, because they established a gender program and started, then they hit the news, free sex change surgeries done at Bear County Hospital, and it hit the fan. And so that program folded. So we kind of kept undercover, and we're able to continue doing our work. I had a lot of lovely patients, people that what struck me the most was they were just normal folks. They weren't psychiatric in the sense. In fact, that's one of the big criticisms always has been, why is this placed in the DSM for psychiatric disorders? There's been a lot of talk about trying to change this and move it out into a medical practice, but it hasn't occurred yet. Part of the reason it still has to be listed in some sort of format like that is because that's why insurance then picks it up and will help pay for this. And now I'm glad to say many insurance companies will cover this. Back in our day, they would say, no, this is cosmetic surgery. Well, we would write letters saying, this is not cosmetic, this is medically necessary for the person's psychological well-being. And the courts upheld that. So insurance companies had to pay. So then they got smart. They said, well, we won't cover any gender-related procedures. Well, we still fought that. And in many cases, we're able to win and help our patients out with that. So the battles have been there for a long time. Some of my patients, I recall one from New Mexico. She never told me what she actually did. She was a male to female trans woman, another term that we use. But she said she worked inside of a mountain in New Mexico. So two and two together, she was obviously high up in military intelligence and our nuclear program. And she had what was necessary up there to be able to do it. I've had many patients who were engineers, who were doctors, teachers. I've had several that have been faculty members at universities around the country. One that was a full tenured professor in Kansas that came down here for her surgery and then ended up leaving the profession and moved to California and had a good life, continues to have a good life out there. So all backgrounds, all socioeconomic status, all races. This is an equal opportunity kind of situation. It is not considered, in fact, I think I had another comment here. Let's see here. The expression of gender characteristics, including identities that are not stereotypically associated with one's assigned sex at birth, is a common and culturally diverse phenomenon that should not be judged as inherently pathological or negative. So it's basically just a variation on theme. And so now today, we have people who have all sorts of identities. We started out thinking that, okay, you want to change to be female, so you must be female up here, or you want to become male, so you must be male up here. But we didn't understand it all back then. Now there are all sorts of multiple identities people can have, and multiple attractions to partners. That's totally different from gender identity. Gender identity is that personal, private sense of being male or female, or somewhere along the continuum. And for most of us, that is congruent with our sexual anatomy. When we're born and doctor looks and sees something down there, okay, you got a boy. But today we know that's not necessarily the case. There are many people who are born intersex, and it's not until they get older and they begin to realize, hey, something's not right here. So for most people who are transsexual per se, the classic story is that they start around the age of 5, 6, 7, 8, thinking they're a boy or thinking they're a girl. They associate with those types of kids. They like those types of activities. Maybe they put on dresses or play out in the fields. Maybe they have the nickname of being a tomboy if they're anatomically female. Sadly, if they're anatomically male, they can get some pejorative terms, sissy and queer and things like this. Um, as they get older, though, they begin to recognize, hey, there's something more going on here. And usually adolescence is the time that causes so much strife and grief, because that's when the body starts to change. Changes in the male and female body, and they hate what's happening. Those that are wanting to be men hate the breast development. Those wanting to be female hate the fact that their voices go down and beard growth develops. I mean, those are really stereotypically struggling events that cause much grief among this population. So what we've learned over the years is, how do we address this problem? Well, we can start hormone therapy, hormone replacement therapy, HRT, in individuals when they get to that age of adolescence and they're free to make their own decisions. And that generally involves male hormones for those that are becoming male. And basically that puts them back through adolescence again, but as a male. So they take variations of testosterone. And over the course of a year or two, their voices drop, the hair growth develops, the sex drive goes through the roof. And they enjoy those changes. And for those that are becoming women, they take estrogens, and that slowly begins to soften the skin, develop breast, add to the curves of the body. Doesn't affect the voice at all. So sometimes, sadly, if a male has already been through adolescence and has a deep, husky voice, he's probably going to need voice therapy, voice training to address that issue. Some surgeons go in and do some shaving on the trachea, but that's, again, rather dangerous and not always a good outcome. So we can do some of those things to help people, and in many cases, those are reversible. But that's not all that's available. Today, there are surgical outcomes. That's where, when people get to the end of the real life test, which is what it's called, according to the standards of care, that's where they need to begin living full time in that desired gender role. And they need to do that for a year or 2 years and work the kinks out. In other words, deal with work, deal with families, deal with those issues. I had one patient who was a policeman with Houston Police Department. And when he came out, he lost his wife, he lost his kids. He had the support of the police department, though. Went through the transition, completed his surgery, didn't have a lot of support from his buddies on the force, so he ultimately retired. But he successfully dealt with it. There's an attorney in Houston by the name of Phyllis Fry. Phyllis is herself a trans woman, has had surgery, was married for a number of years. Her spouse just passed away this past year. And she's also a municipal judge in Harris County and an attorney. So she has helped many of our folks get their names legally changed. And after they've had sex surgery, gender affirming surgery, they can get their credentials changed. So in other words, in Texas, you get the M or the F on your birth certificate, you can get a court order to change that. And it will change it then to baby F or baby M. And so you'll have your completeness done at that point with a birth certificate. The US government recognizes this with a letter from your therapist or surgeon. You can get your passport changed into the new sex. And that's permanent. You get that every time you renew your passport. So there's been a lot of things that have occurred in a positive sense. Court cases have upheld the fact that people that were born in one sex ended up changing and got married. And then it's divorce time. And somebody says, hey, this wasn't a legal marriage. Well, they've been to court and found out, yes, it is a legal marriage. So a lot of battles. But today, politics is rearing its ugly head again and getting involved with medical practice. I have included to you, with you in your handout this morning, a letter from the president of the Texas Psychological Association, which reflects some that has gone on in Texas. But this is across the entire country. It's across the world. There was a case, Tavistock versus Bell in the High Court in England, that was found again that you can't be treating underage youths, adolescents with this, even with parental consent. According to this, Governor Abbott sent a letter to the DFPS commissioner asking about gender confirmation surgeries for adolescents. And the commissioner came back saying, genital mutilation of a child through reassignment surgery is child abuse, period. And today, many practitioners, counselors, surgeons, people who prescribe hormones face losing their licenses and face imprisonment if they treat adolescents, even with parental consent. So that has been really something that Texas Psychological Association, also WPATH, that's the World Professional Association for Transgender Health, WPATH.org. I invite you to jot that down. And if you have a chance, go visit WPATH.org, because that's where you can read the entire standards of care. And you can read all these controversies that are going on, and you can review how active WPATH has been in addressing these concerns. What we do can offer adolescents are hormone blockers. What does that mean? As they're approaching their hormone years, their adolescent years, you can provide medications which sort of turn off the testes, turn off the ovaries, to where they don't start secreting those hormones, which will change the bodies. And that's okay, it's reversible. You stop it, those things can start to come forward again. So that's a reversible treatment. In some cases, again, with parental confirmation, you can start some low doses of hormones themselves, which help these children begin to identify better with who they feel they are. There's plenty of research, and you read it from WPATH, that suggests that treating adolescents for this condition helps them psychologically, reduces the risk of suicide, reduces the risk of depression. And so medical outcome, we consider this to be the standard of care, the appropriate course of treatment. We don't force it on anybody. It's offered, and with consent by parents, this can move forward. But that's now being challenged. They also have considered the top surgeries, particularly those that are female to male. You know, you can imagine how they hate breasts, and they refer to it as top surgery, meaning reducing that breast to where it's more of a flat chest. The guys, the trans men, they just love that. That's the first surgery they want, and they're proud to go out and take their shirts off and go to the beach. But that is something that, again, politicians are going after, saying this is abuse, and it's not abuse. I also have a copy. I did not include it here, but you will find this on the WPATH website, a statement on the surge of anti-trans legislation occurring within the US. It says here, proposed anti-transgender legislation threatens healthcare providers with risk for fines, loss of license, practice, imprisonment. Most importantly, these laws will prevent young people from receiving beneficial, often life-saving services that have strong evidence of success and are supported by mainstream healthcare professional associations. So again, the stance is very clear, but also we're facing political backlash. So people are encouraged to address this and talk to their legislators and move forward with trying to stop this type of behavior occurring. Today, there are many happy individuals out there who've been through our program in Galveston. As I said, we've had people of all ages. I think our youngest patient was probably 15 when he, female to male, started coming from Florida to Galveston. Every couple of months, he and his family would bring him over here for appointments. Went through the process. We offered them hormone therapy. The parents accepted that. He began on that. And eventually, when he was 18, he did get his surgery. Dr. Powell did the bottom surgery, and I think Dr. Wong did the top surgery. And now he's out there and went on to university and is having a successful life. So that was probably our youngest patient. Our oldest patient was up in her 80s, male, female, went ahead and had this surgery done. Most are probably in the 20 brackets, and then the 30s and 40s. So often I see people that have come in kind of midlife crisis. You know, they got married, had kids, thought that's going to make me a man, you know, stop these thoughts. It doesn't, but they address their responsibility, raised the kids, took care of the family, and now they get to the point saying it's my turn, and they come in for treatment. I've had several patients who were very fundamentalistic, ministers, Baptist ministers, seeking treatment. But unfortunately, they kind of went back into the woodwork because the thought of facing their congregations or coming out was just too much of a challenge. Many of our patients were very concerned about religious issues. And what we did was we established contact with certain priests and rabbis and others who were available that we could refer patients to talk to for support in this area. And they sought that out, and it helped many of them tremendously. So our folks are concerned, just like all of us here, just living a normal life. And modern medicine today is able to give them that opportunity through hormones, through surgery, through assistance with legal matters. And that's all they want to do is just blend in. They don't want to stand out. They don't want to be ridiculed. Some have been obviously very professionally oriented and taken up the cause in the public. Caitlyn Jenner one. Some of you probably remember Renee Richards, the tennis player, and of course, Christine Jorgensen and others. But these are few and far between. Most folks just want to live a simple life, ordinary life, and get on with things. And I've had some that come back to me say, I got my new boyfriend and brought him along, or my new girlfriend. Can you help me with this? I say, well, bring them in. And then I'll usually say, you have something to tell her, don't you? And I toss it right back in their lap. I ain't gonna do the dirty work. And so I make them tell the situation, but I'm there to support. Say, yes, it's true. It's a medical condition. It's not an illness. It's remedied. And he loves you very much, or she loves you very much. And then they go off and think about it. In many cases, it works out fine. So we have addressed all these sorts of issues over the years here in Galveston. And it's been a very rewarding process for me. And I think for many of our folks. And what we often did at the Rosenberg Clinic is every few months, we ended up getting down to twice a year and then finally once a year because it was just exhausting. But we would send out notices to all of our patients and invite them to the Rosenberg Clinic on a Saturday. And they would come down and they would come to the clinic, and we just had basically a large support group. The staff, we would prepare sandwiches for them, or else we'd go out and get some food trays. They'd put a couple dollars down donation to help us with that. But for a couple hours, we'd sit around in the group, and people would go around and say who they are and where they're from and what's going on in their life. And then I'd said, so-and-so, you need to talk to her later, or you need to talk to him later. And then we'd take a break, and people would be around just talking with each other. And then we'd get back together in two small groups, one for the guys, one for the ladies. And their colleagues and friends who came with them. This is wonderful. As doctors, we only know so much. But actually getting people together who have been there, who know what it's like, that is extremely rewarding. We've had a lot of parents come too. I had one mother once who thought I was probably close to the Ayatollah Khomeini or something, and threatened to do an investigation on me because her daughter wanted to become a man. And yet finally, when the daughter was able to explain to her and she came down and met with me, suddenly things changed. She became one of her son's greatest allies at that point. So again, education can help, and people can change their attitudes, but you need to kind of be supportive and help them along without threats. So at this point, I'll suggest, anybody have any questions about what I've discussed? Yes, sir.
Was there ever a time where there any possibility of Medicare or Medicaid covering that kind of therapy?
Now it can. Not in my day. No, it didn't. In fact, that's a good point. Most people had to pay out of pocket. So you were talking $20,000, $30,000 to get this surgery done. And that was a sign of motivation too, that people would save their money for that. But then some insurance companies came along to cover that. Government didn't. Now the Veterans Administration is actually covering some of this. In the most recent cases I've heard, they're stepping in to agree to cover these procedures. So what a change. Big change. Okay, very good. Thank you so much.
Thank you. That was a great history and summary.